Hello everyone, I am Dr. Anoop Das, glaucoma consultant, Insight Eye Hospital, Varkala from Kerala, India. This month, I want to highlight some of the facts about vision which we celebrated as World Sight Month. The World Sight Day was celebrated on 12th of October 2017, and on this very day, I just wanted to say few words regarding the blindness prevalence in India. 1 out of every 3 individual in the world has blindness who lives in India. About 18 million people are blind in India, where 80% of the peoples are still undetected. So theme of this World Sight Month is Universal Eye Health with a call of action, make vision count. On this occasion, I wanted to talk something regarding glaucoma, which I'll elaborate and take a few minutes of yours. Glaucoma is one of the third most commonest disease in the world to affect the eye, and it is a very malevolent disease which leads to complete blindness of the eye. Many articles and many publishers has shown that glaucoma is basically a silent killer of sight. In other words, we can say it's a silent thief of vision. Without any alarming sign, the patient will ultimately lead to blindness. Like other symptoms or signs of other diseases, glaucoma won't give any alarming sign. There will be neither halos nor diminution of vision, never the patients having headache, but yes, those symptoms sometimes may be prevalent in patients. So without any alarming signs, glaucoma affect any of the patient. Now many questions people used to ask, which age is the commonest age for glaucoma? In our experience, as well as the experiences from most of the elite institutes, there is no age for glaucoma, but glaucoma may affect the persons who are aged more than 40 years, or who are having diabetes or hypertension, or the patients who used to take steroids or any sort of topical eye drops which are harmful to the eye. So next, what we can ask is, what is glaucoma? Glaucoma per se is a disease which is a disease of optic nerve, which will affect the optic nerve and ultimately lead to loss of vision, and it is contributed by intraocular pressure. Here the intraocular pressure means the eye pressure used to become high, but sometimes in normal persons also whose pressures are normal, eye pressures are normal, they also have the disease as such. So those persons who are getting eye pressures without higher value are called as normal tension glaucoma. So glaucoma as such, you cannot predict with the simply recording of intraocular pressure. Every patient has to go through a series of investigations like perimetry, that is Humphrey field analysis, optical coherence topography of the retinal nerve fiber layer, the central corneal thickness, and other investigative procedures. So those investigative procedures are basically meant to detect glaucoma at the early stage. As we know, glaucoma once affect will lead to complete blindness. So early detection is very, very important to prevent the disease per se. As I have told you, 40 years of age is the age where after that glaucoma may prevail, but it can affect the children also, where we used to call it it's a congenital glaucoma, some adults, and as well as old age also. We give some alarming signs to those persons or those patients who are basically diabetic, hypertensive, or who are on continuous topical as well as oral steroids, to have their intraocular pressure checkup every 6 monthly or 1 yearly according to the advice of the physician. Our next question is that whether this glaucoma is preventable, or what are the surgical or medical treatment available for this glaucoma. Before going to the treatment planning and other modalities of surgical intervention in glaucoma, I would like to classify glaucoma into 3 basic types, that is primary angle closure glaucoma, primary open angle glaucoma, and normal tension glaucoma. In primary angle closure glaucoma, basically the structural portion of the eye is been blocked and the aqueous outflow is not proper. In open angle, though the blockages are not visible outsidely, but it may prevail inside the eye, which may lead to increase in the intraocular pressure. And in normal tension glaucoma, basically here the pressure of the eye is normal, still then the optic nerve damage is continuously going on. So those are related to low blood pressure at night or genetically in some persons. When we talk about the pathophysiology of glaucoma as well as the treatment, when we plan for the treatment of glaucoma, we used to see whether it's a primary angle closure glaucoma, normal tension glaucoma, or primary open angle glaucoma. The initial modality of treatment in each and every cases, as we judge from our evaluations and investigations, we used to do medical treatment. So lots of medications are available to control pressure, and we advise the patients to go for a regular routine intraocular pressure checkup as well as other investigation procedures. For primary angle closure glaucoma, where the block is basically in the outflow pathway, we used to tell patients to either go for two treatment, either it is a laser or surgical. Lasers treatment are widely available as well as it is safe. So in mild to moderate cases, we used to go for anti-YAG laser, that is peripheral iridectomy, or sometimes we may intervene the patients with surgical trabeculectomy. Surgical treatments are advisable for those patients who are having intractable glaucoma in spite of the maximum tolerable medication therapy, and to the patients who are in acute emergency. So lots of surgical options are available nowadays. It's like trabeculectomy, express mini shunt, or glaucoma valve surgeries. So our physician used to decide which treatment modality is safe for the patient. In nutshell, I can say, though it's a silent thief of vision, glaucoma, yes, if detected early, can be prevented. If treated early, can lead to basically the benevolent effect of good vision, and if it is treated properly, the vision can be restored. Insight Eye Hospital, a new venture in Varkala in Kerala state, is all set to go to combat those sort of diseases like glaucoma and other diseases from retina as well as lenses. We give everybody an opportunity to see us and explore the investigative procedures which we are having, and we'll definitely try to help from our side to treat you at our best. Thank you.